so now we're getting into the lower extremity. Okay? So we mentioned before, if you say leg in anatomy, really you're talking about here the lower leg. Okay, so this is the thigh, and then this technically is the leg, which is kind of the opposite in the upper arm. This is the arm, and this is the forearm. So in anatomy, usually if you want to make sure that you're talking about the entire lower, you refer to it as the lower extremity. Because if you just say leg, you don't know for sure if you're talking about the whole thing or if you're just talking about the lower part. And so then actually you have there's three segments. You have the thigh, the leg, and then the foot. And so for the thigh, you pretty much have one bone here, which is the femur, right? Obviously that's going to be the largest bone in the body. And then articulate, what does it articulate with up here? It's going to be the acetabulum. And then down here, it articulates with the tibia. And the fibula doesn't really, it doesn't articulate at all with the femur. The fibula. You can see on the fibula on the side, it's considered part of the knee joint, but it doesn't actually, the main joint in the knee is between the femur and the tibia. Okay? So then the markings that we have on the femur are going to be the greater and lesser trochanters. Okay? Greater trochanter is something you're going to palpate, typically not palpating the lesser trochanter. And obviously, anytime you have a prominent bony thing like this, it's going to be attachment for muscles. Okay? There's a lot of muscles that are going to attach onto this, some more that are going to attach onto that. Okay? Then you can have on this back side here, the gluteal muscle attaches a little bit lower than the greater tuberosity, so you're going to have a gluteal tubercle down here. And then just as what we had in the upper extremity, you're going to have medial and lateral condyles down here at the distal line. So you can actually have the articular portion is the condyle, and then this is going to be the epicondyle. And then here you have the linea aspera, which is going to be on the back side. So that's this line that goes all the way down the back there. Okay. Again, that's going to be an area where a lot of the muscles are going to originate from. And then when you get down, I mean, obviously here you have the patella, and so then you're going to have a surface where the patella articulates with the femur. And then when you get down into here, when we talk more about the knee, that's where you have the intercondylar eminence, or intercondylar notch. Okay? It's just that groove that goes underneath there. And then on the medial side here, you can have the adductor tubercle. Okay? So you have the adductor muscles coming down like this, so that at the very distal end, that's where it's going to attach. Okay, so you can see the ones in the notes with the underlines. Those are the things that you need to know for palpation, right? Greater trochanter, that's pretty easy to find, right? Okay, and then the lateral medial condyles here, and then the adductor tubercle. So if you're palpating up here, you just go up a little bit right there, and you can feel the top edge of the bone. So if you're coming down like that, where you feel the knot. And we'll go over those later again too. Now, a lot of times you hear about people breaking their hip, right? Usually when you break your hip, it's going to be here at the neck, and that's the weak part here. Okay. And then at the tip of the actual femur, I don't know if you can see it, there's a little hole right at the top there, and that's the fovea capitis. Yeah. Fovea. It's right in the So there's a ligament that attaches right there. It's a ligament teres, and that goes into the acetabulum. And then there's also an artery that goes in through that area where the ligament is. So sometimes if you have injury to that artery, you can have vascular problems in the head of the femur. You get what's called avascular necrosis of the femoral head, which is bad news. And then we'll talk a little bit about the patella. Okay? In some ways, actually, patella, we always talk about our bone as being inert tissue. In this case, though, the patella is really more part of the contractile tissue. So what it is actually part of the quadriceps muscle. What it does is it gives better leverage for extension of the knee. Because if you didn't have the patella, then the muscle would be running in the groove against the bone. But in here you have actually cartilage surface going against cartilage, and that gives better leverage for the muscles. So then as we talk about the actual muscles, we're going to talk about different compartments. Like when we talked about the upper extremity, we talked about in the upper arm, we had the anterior compartment, posterior compartment. In the forearm, we had anterior and posterior. Now in the leg, we're going to be talking about 3 different compartments. So you're going to have the anterior compartment, which is going to be the quadriceps. Then you're going to have the posterior compartment, which is going to be the hamstrings. And then you have the medial compartment, which is going to be the adductors. And some of those muscles are going to cross 2 joints, and some are only going to cross 1 joint. Right? So if muscles on the front of the thigh, if they're crossing 2 joints, what are they going to do at the hip? What kind of action are they going to have at the hip? Yes. Right? They're going to flap like this. And then what kind of action are they going to have at the knee? They're going to extend like that. Okay? And now some of them are only going to cross the knee, and those are going to be knee extensors. Okay? But also some of the hip flexors, the major hip flexors is actually the iliopsoas, which comes from the spine here. We'll be talking about that. So that's going to be deep inside the abdomen, and that's going to pull up right here. And that's going to attach to the lesser trochanter. Okay, so then what are we going to have on the posterior compartment? What are the actions of those muscles going to be? What are they going to do at the hip? Extension. Yeah. And then what are they going to do at the knee? Okay, so those in the thigh, most of them go across both joints except for the short head of the biceps femoris. Then also you're going to have some deeper muscles here that are going to extend the thigh. And those only cross 1 joint. Now the major one of that's going to be the gluteus maximus. So then that leaves the medial compartment, which is going to be the adductors. And then there's a couple other muscles that sort of you're not sure which compartment they're in, like the sartorius. It starts up here, and so it starts out more in the anterior compartment, and then it kind of ends up going more into the medial compartment. And then the fascia lata is what kind of encloses the whole thigh. Question?
Well, that's kind of my question is, the tensor fascia lata and IT down, are those considered part of the quads, is that, or like what compartment are those considered?
The TFL? Yeah, the muscle, well, they're not part of the quadriceps. But again, those are kind of a little bit different muscle. It's more of the anterior compartment, tensor fascia lata. Okay, because you have the iliotibial band, which is you have the fascia lata, which pretty much encloses the whole thigh. And then you have a thickening of it, which is the iliotibial band on the lateral side here. And then the tensor fascia lata is the muscle part right up here. And that attaches into that and stabilizes the iliotibial band and contracts the fascia lata.